Dr. Ornish, it's been 15 years since my prostate cancer diagnosis, and my recent visit to the National Cancer Institute confirmed that there is no progression. For much of that time, I have followed your lifestyle program. From your research, how likely is it that those changes made a difference?
Probably very likely. The good news is, in fact, I just gave a talk last week at the International Conference on Nutrition and Medicine at George Washington University that PCRM did with Dr. Peter Carroll. He reviewed the latest. Peter is the chair of urology at University of California, San Francisco, where I'm a professor of medicine, and probably the best urologist on the planet right now, but if you need surgery. But he also took a leadership role many years ago at a time when most people were diagnosed with prostate cancer to say, cut it out. He has the largest, because of that, he has the largest cohort of men doing what used to be called watchful waiting and now really called active surveillance. Watchful waiting has this kind of passive waiting for something bad to happen, almost like sitting under a sword of Damocles, whereas active surveillance is more monitoring the disease more carefully. And then if it does start to be a problem, then you can intervene at that time with other interventions. But even active surveillance really is more on this actively surveilling, not so much on what you can do about that while you're waiting, in terms of changing lifestyle. Now, it turns out that the vast majority of men who get diagnosed with prostate cancer have what's called a Gleason score of 6 or less. And as you know, it's a measure of how aggressive your prostate cancer is. And as you know, most men are likely to die with prostate cancer rather than from it, because for most men, the tumor is almost an incidental finding. It's not like that they felt anything, or it was more just as a result of having like a routine PSA screen, for example. Yeah. And the older you are, the more likely they are to find prostate cancer. But for most men, they don't necessarily need an intervention, and there are some other markers they can look at in terms of some more precise genetic markers to get an even clearer sense of how likely is it that you have a tumor that's likely to spread, in which case, there is a subset of men who do need surgery or radiation or brachytherapy or interventions like that. But most men don't. Now, it's hard to say how likely it would have been had you done nothing 15 years later, but clearly, Dr. Carroll and I did a study years ago. It was a randomized controlled trial published in the leading peer-reviewed urology journal that looked at men who had biopsy-proven prostate cancer, who had Gleason scores of 6 or less, and who had decided, for reasons unrelated to our study, not to be treated conventionally. So we could then randomly divide them into 2 groups, which you can't usually do with most forms of cancer, because normally when people get cancer, they want to get treated right away. But this was an exception to that. And half the people we gave our intensive lifestyle intervention to, and half of them we didn't. And what we found is that after a year, none of the people who went through our lifestyle medicine program needed surgery or radiation, but 6 of the usual care control group patients did. This was a study of about 93 patients altogether. And after 2 years, we found similar that most of the people who made these lifestyle changes didn't need that. We also found that PSA levels, which, as you know, is a marker for prostate cancer, went down in the group that made the lifestyle changes, went up in the group that didn't. And we actually did this in collaboration not only with Dr. Carroll at UCSF, but Dr. Bill Fair, when he was the chair of urology and urologic oncology at Memorial Sloan Kettering Cancer Center. So we drew the bloods in San Francisco and FedExed them to New York, where they actually ran them. And the third metric that we looked at was, as you know, PSA is an imperfect marker for prostate cancer. So we actually sent their blood to Bill Aronson at UCLA, who had a standard line of prostate tumor cells growing in tissue culture called the LNCAP cell line. When we added their serum to this standard line of prostate tumor cells growing in tissue culture, there was a 70% reduction in the tumor growth in the intervention group compared to only a 9% in the usual care group. And so, it's kind of mind-boggling when you think about it, that when you make these lifestyle changes, something ends up in your blood that we haven't identified yet. Then when you add it to a prostate tumor growing in someone's lab in tissue culture, inhibits the growth of that tumor. We also know from epidemiological studies from like the Harvard Physicians and Nurses Health Study that when men switch from eating a typical American diet to a whole foods plant-based diet, particularly when they make other lifestyle changes, not only does it decrease the risk of getting prostate cancer by quite a lot, but it also, not only does it help reduce the likelihood of increasing the risk, but you actually decrease the risk. You're getting a double benefit. You're not only not increasing the risk, but you're actually lowering the risk. That there are thousands of substances in fruits and vegetables and whole grains and legumes and soy products that have anti-cancer, anti-aging, and heart disease properties. And so the more we learn about this, the more reasons we have to explain why these simple lifestyle changes are so powerful and how quickly they can occur.